This segment is sponsored in part by One Brooklyn Health.
Access to health care can be a challenge for anyone, but in some New York communities, racial and gender health inequities pose a serious problem.
Dr. Torian Easterling from One Brooklyn Health is here to talk about how he and his team are bringing healthcare equality to communities. Welcome, Dr. Easterling.
Thank you. Thank you for having me.
Thanks for being here.
There is a lot. So when we use the phrase health equity, what exactly are we talking about?
Yeah, really good question. And I think it's a really important term that we all have to be familiar with. When we're talking about health equity, we're essentially saying that there are differences in health outcomes that people are experiencing, and specifically people of color, people who are living in low-income communities, people who are disabled. And the work that we have to do is really making sure that we're addressing individual factors, environmental factors, and societal factors to make sure that everyone has the best optimal choice to get their health.
So what exactly is One Brooklyn Health doing to address racism and cultural bias in healthcare?
Well, first we have to acknowledge that it's a huge task, and
Yes.
it's not just the role of One Brooklyn Health to really address it, but we're asking the right questions, and that's being intentional in some of the work that we're doing. One of the efforts that we're really rolling out now to address racism in healthcare is a program that we're calling Brooklyn Health Equity Index. And this survey is trying to uncover racism in care. And so we're working with our providers to make sure that we're asking these intentional questions, but doing something about it. And this is actually a program that we worked with SUNY Downstate of Health Sciences and Arthur Ashe of Institute Health.
Sure.
Wow.
So in addition to improving access to health care, what are other challenges One Brooklyn Health is trying to address?
Well, what we're trying to also do is shine a light on the fact that it's not just about access to health, as you've already mentioned. It's also about the conditions in which you live in. It's where you work, it's where you pray, it's where you play, and those conditions are really important. So it's the housing factor, it's the food that you eat, access to good transportation. And so some of the work that we're doing, we're partnering with an organization called Brownsville Partnership, and we're actually surveying households to say, how can we ensure that your repairs are being done in those households? And how do we make sure that individuals can really make sure that they're living in equitable housing so that they can have better health outcomes, addressing respiratory issues, mold issues, et cetera.
Wow, so that is what you're doing to make sure that the people are treated in their own homes.
Correct, absolutely.
Yeah.
That's fantastic.
Yeah.
Okay.
You're not just treating people when they come to the hospital, the overall health and wellness,
That's
as
right.
you mentioned.
Yeah.
Talk to us a little bit more about when they're in their own homes, what you're doing, because I think that's something that really sets it apart from your average healthcare organization.
Yeah. I mean, we see ourselves as an anchor institution. And so to do the work that we do, we want to make sure that our community knows that it's really about improving the conditions in our community. And so we talked about housing. It's also about ensuring access to good food. We started a food box as part of our commitment to food as medicine initiatives for our institution. And so we're giving access to not only good food, but we're also supporting our food systems in Central Brooklyn. And so it's the supermarkets, it's your pantries, it's also saying that your health care, your health system can also ensure that you get good access to food.
Fantastic.
Thank you so much for that work you're doing. Thank you for being here, Dr. Easterling.
Thank you for having me.
We appreciate it.
Yes, and don't forget to scan that QR code to learn more about what One Brooklyn Health is doing to improve healthcare equity and